Prevention of teenage pregnancy. Did you know that 1 in 10 young Filipino women aged 15 to 19 has begun childbearing? 8% are already mother, and 2% are pregnant with their first child. Or that pregnancy and childbirth complication are the leading cause of mortality in girls aged 15 to 19 around the world. Data from the Philippine Statistic Authority has found more than 18,000 girls between the age of 15 to 19 had a second child. The Philippines has one of the highest teenage pregnancy rates in the world. Here in the Philippines, we believe in our national hero, Dr. Josepe Rizal, sayings that youth is the hope of our motherland. In their hands lies the future generation to follow. But as we see from the situation nowadays, what we are expecting from the youth is that, contrary of the saying, teenagers are prone to pregnancy. Almost every year, there is a rapid increase in the number of pregnant youth. One of the major causes of this problem is that most of the youth nowadays grew up in broken homes. Parents, either the father or mother of the youth, choose to leave their children behind because they can no longer handle their obligation as parents. About this problem, our government is now working on the reproductive health bill, or RH bill, as one of the most effective solutions to teenage pregnancy and increasing population of our country. Most teenage girls don't land pregnant, but many do. Teen pregnancy carry extra health risk to the both mother and the baby. They have a higher risk for pregnancies related to high blood pressure and its complication. The risk of the baby includes premature birth and low birth weight. The main focus of the teenage pregnancy is the high rates of the pregnancy burden at all teenagers. Their prospect decline compared to young women who delay their first birth until the age of 20. Or older teen mother who complete less school are more likely to have families and more likely to to be a single parent. The children are born to bear the brunt of their mother young age. The teenager who chooses abortion seems more independent and self-assured, made their decision basically and themselves, and had a more realistic view of pregnancy. To, to term appear the submissive and less capable of the integrating various elements of reality into their decision making. Their choices seem strongly influenced by their parents, family, friends, and because of these outside influences, the patient may perceive their decision, perceive her decision to be externally determined, learning more susceptible susceptible to guilt, feeling, and allowing her to avoid full consideration of the implication of immediate childbearing, interpersonal relationship, and the patient personally were viewed as the major influences on pregnancy resolution. Teenage pregnancy is one of the main reasons why teens drop out of school. More than half of teen moms don't graduate high school. The lucky ones get help and support from their friends and family. As parents of teen moms find it difficult to support the moms the mom, and the baby. Before you were conceived, I wanted you. Before you were born, I loved you. Before you were here an hour, I would die for you. This is the miracle of mother's love. Ways to prevent teen pregnancy. First is openness. Talk openly to partner or trusted adult and ask how they can get birth control if they choose to be sexually active. Openness, respect, integrity. These are the principles that need to underpin pretty much every other decision that we make or that you make. Second is education. Using contraception during sexual intercourse can also prevent pregnancy. Whether using barrier of hormonal method, contraceptives can help to change attitudes and behavior towards sex practice. And investment knowledge pays the best interest. The third is abstinence. Is when the person decides not to have sex until they are married. Some think of this is an old fashioned, but for me, I think it is morally the best thing to do, and complete abstinence is easier than perfect moderation. The fourth is contraception. Means using method mechanical or chemical to prevent pregnancy. Various contraceptives work in different ways, but they are all designed to prevent pregnancy. Even if you wish to practice abstinence or delay sex, it's important to learn as much as you can about contraception. Contraception, contraceptive protection is something every woman must have access to to control her destiny. However, for me, presenting teenage pregnancy is not all about collaboration between teens. It's all about collaboration between teens and adults. So now, you may be wondering if how you can help prevent teenage pregnancy. Well, as parent, you can help by empowering your teens, by supporting them, by knowing, by helping them accomplish their goals, and also knowing their feeling at school. And of course, as teens, you can help by investigating, by getting informed, by knowing about STP, about contraception, and all of these topics. They stay motivated, stay determined, and most importantly, continue to be strong and wild because each path is different with multiple